your gums pull back and show too much of your teeth, a dentist will meticulously cut around the damaged area. This creates a precise flap to prepare the area for the following step. Next,
is it possible to make your gums grow back? Not naturally, but surgically. So a gum graft is a minor surgical procedure as well that is usually indicated with patients affected by gingival recession. So basically receding gums, either way, so the gum pulling down or pull it up, depending if you're in the upper or the lower jaw. The gum graft involves taking a piece of new gum, usually from the roof of the patient's mouth, and then we basically stitch it back in the areas or around the tooth or the teeth where the patients have their recessions. The goal of the gum graft, of course, is to, first of all, thicken the gum, give the patient a good band of quality gum. Second of all, of course, the goal is to help cover as much recessions as we can. So it has a health purpose of, let's say, improving the prognosis of the teeth as well as a cosmetic kind of purpose. So the procedure, depending on the number of teeth that are involved, can take starting from 1.5 hours. In some cases, we can do some full arch cases, so the whole upper or the whole lower jaw. So in that case, the procedures can take up to 3 hours or 3.5 hours. In some cases now, with new research, we've got new materials and new membranes that can help us avoid take the graft from the roof of the mouth. So the goal is still the same, actually covering the recession, but of course there's going to be less discomfort because we can use some collagen membranes, for example, that can help us achieve, let's say, the same result, but basically without having to take the graft from the palate.